Hey everyone, today I'm diving into a serious topic that often gets misunderstood: antisocial personality disorder, or ASPD. First off, what is ASPD? It's a mental health condition characterized by a long-term pattern of manipulating, exploiting, or violating the rights of others. Sounds heavy, right? That's because it is. People with ASPD often struggle with empathy and have a hard time understanding the feelings of others. There are a few types of behaviors associated with ASPD. Some might be charming and manipulative, using people for their own gain. Others might be aggressive and reckless, ignoring the safety and well-being of those around them. So, what causes ASPD? It's believed that a mix of genetic and environmental factors play a role. If someone has a family history of personality disorders or grew up in a chaotic or abusive environment, their risk is higher. Speaking of risks, there are several factors that can increase the likelihood of developing ASPD. These include childhood conduct disorder, a family history of personality disorders, or even brain abnormalities that affect judgment and impulse control. But what about prevention and precautions? While there's no guaranteed way to prevent ASPD, early intervention can make a big difference. Parents and caregivers should look out for signs of conduct disorder in children and seek help early. Therapy, especially cognitive behavioral therapy, can be effective in managing symptoms and improving social skills. In conclusion, ASPD is a complex and challenging disorder. Understanding its causes, risks, and the importance of early intervention can help manage its impact on individuals and society. If you or someone you know is struggling, don't hesitate to seek professional help. Thanks for watching, and remember, understanding is the first step to compassion. Additional content. Let's delve a bit deeper into the types of behaviors associated with ASPD. People with this disorder can exhibit a range of behaviors that can be quite varied. For instance, some individuals may come across as very charming and persuasive. They can be quite adept at convincing others to do things for them, often using their charm to manipulate situations to their advantage. This manipulative behavior is often used to exploit others for personal gain without any regard for the feelings or well-being of those they are using. On the other hand, some individuals with ASPD may exhibit more overtly aggressive and reckless behaviors. They might engage in physical confrontations, act impulsively, or take unnecessary risks that endanger themselves and others. This disregard for safety and responsibility can lead to a range of negative outcomes, both for the individual with ASPD and for those around them. Understanding these behaviors is crucial for recognizing the signs of ASPD and seeking appropriate help. It's important to remember that while these behaviors can be harmful, they are symptoms of a deeper underlying issue that requires professional intervention. If you suspect that someone you know may have ASPD, it's important to encourage them to seek help from a mental health professional. Early intervention and appropriate treatment can make a significant difference in managing the disorder and improving the individual's quality of life. Additionally, raising awareness about ASPD and promoting understanding within the community can help reduce the stigma associated with the disorder. By fostering a supportive environment, we can encourage more individuals to seek the help they need. Education and awareness are key components in addressing the challenges posed by ASPD. By learning more about the disorder, its causes, and its effects, we can better support those affected and work towards creating a more compassionate society. Remember, if you or someone you know is struggling with symptoms of ASPD, don't hesitate to reach out for professional help. There are resources available that can provide support and guidance. Thank you for taking the time to learn about ASPD. Your understanding and compassion can make a real difference in the lives of those affected by this challenging disorder. Together, we can work towards a better understanding and a more supportive community for everyone. Thanks for watching, and take care.